My name is Joe Murray. I'm a gastroenterologist in the Mayo Clinic in Rochester, Minnesota. The treatment of celiac disease is a gluten-free diet. And while that trips off the tongue very quickly, it's a much harder diet to implement and to maintain in the long term. There are particular challenges, and for people who live gluten-free, a particular challenge can be eating outside the home, and particularly challenge is traveling. Just because somebody has celiac disease doesn't mean that they should not travel, and certainly doesn't mean that they cannot eat out. But they do need to take particular measures to reduce the likelihood that they become contaminated with gluten. So this can be forearming themselves with knowledge about what particular types of foods might be likely to contain gluten, considering the restaurant that they're going to and their conversation with the food server. Certainly traveling abroad to countries with different languages might require or might benefit from having something such as a card, pre-printed card translated into the local language that informs the food service personnel about the need for gluten-free. Now, of course, some geographic locations are very familiar with a gluten-free diet. And several travel destinations, for example, do a great job on providing gluten-free options for their customers. Many cruises, for example, will make a special effort to provide gluten-free food for people traveling with celiac disease. It is important to contact them well ahead of time, probably even important to make that as part of the original booking. Recommendations from other people with celiac disease, from support groups, travel blogs, for example, may also be helpful. And ultimately, it's always important to be prudent while traveling, to remind the food service personnel about your particular needs. And if it looks like it contains gluten, it might well contain gluten.
My name is Jacalyn See, and I'm a clinical dietitian at Mayo Clinic. Traveling with celiac disease can be challenging, but certainly no reason to cancel your vacation plans. With the increased interest in celiac disease and gluten-free diets, there's a wealth of information that can help you plan your vacation. The key is planning. Another option is to contact a support group in the area that you'll be visiting. They can give you first-hand information on places to eat and shop in that location. If you're going on a long trip, you might want to book a hotel room that has kitchen facilities, or at least a refrigerator. That way you can prepare some of your meals in the room and avoid eating out. This is a good way to save money as well. For shorter day trips, take your lunch with you. Gluten-free sandwiches are easy to pack, as well as fruit, yogurt, chips, trail mix, and other snacks. If your plans require air travel and you're traveling inside the U.S., it may be easier just to take your own snacks with you. But if you're going to be traveling abroad, when meals are usually provided, check with the travel agency before you plan your trip. They can let you know which airlines offer gluten-free meals. Many airports also carry gluten-free snacks such as fruit, yogurt, nuts, and so forth. But it might be better just to bring your snacks with you in case you're caught off guard. If traveling outside the U.S., there's also the concern about language barrier. Some of the websites carry allergy cards in different languages. So you simply hand the card to your waiter or waitress and explains the gluten-free diet in the native language. Indeed, a stomach ache or diarrhea can certainly ruin a vacation. But even if you don't have symptoms, eating gluten can cause damage to the lining of your intestine, which can lead to long-term complications. The best way to assure a safe and healthy vacation is to plan in advance. Bon voyage!